Do your knees snap, crackle, and pop when you walk? You can probably feel it as you move your knees with your hands on top. Well, you probably have crepitus. Hi, Dr. Malka here, your chiropractor and acupuncturist practicing in Los Angeles, California. And the leading cause of the initial onset of crepitus are tightness in the muscles that cross the knee. And you have several muscles that cross the knee, but the main culprit, which I find in 90% of my practice, my patients, is this quadricep here that comes over here and crosses the knee like so and attaches to the shin. And it really has the most influence over the movement of the kneecap. And so in this video, I'm really just going to focus on stretching this quadricep. And so I'm going to show you 9 stretches. You're probably just going to pick 1 or 2 that you like the best and do them. But I want you to have a lot of options. A lot of them are ready to be if you're in a standing position, or if you're lying in bed, or if you're sitting. So let's get started. And don't forget to subscribe and like and share with your friends. Okay, I just woke up. And so before I get out of bed, I want to stretch this knee out to start the day right. So you can go ahead and lie on your side like this and just grab your ankle like so and bring it to the buttocks. If you have difficulty reaching your ankle, you can just get a belt or a dog leash and bring it around the ankle like so and bring it into the buttocks. And then also, in order to stretch it and intensify the stretch, I'm going to go ahead and push like this with 10% of my strength for 10 seconds. Let's do that. So I'm going to push 10 seconds with 10% of my strength and relax. Try to bring that heel in closer. Push for 10 seconds with 10% of my strength. You could also do this stretch lying down on your stomach. And I'm going to just slide it here for a little support of my abdomen and go ahead and breathe in the F like this. And if you can reach back and grab the ankle, that would be great. Try to not pull on the top of the foot, grab below the ankle. And again, if you lack flexibility, and then go ahead and do what we did before on the side. I'm going to be pushing in this direction like so, and pushing for 10 seconds with 10% of my strength. And then relax, bring in the heel closer to the buttock. And then go ahead and push for 10 seconds with 10% of your strength. And then continue this 3 to 5 times. And you can even do the pushing for 30 seconds or a minute if you'd like. So we're standing. Go ahead and put your leg on the back of the chair like this, and you may want to hold on to something. And here, actually, I'm doing a pretty good stretch here, just like this. And this might be enough for you. But you can also go like this and bend your knee. And you see as I bend the knee, the heel comes up closer to the buttocks. Or you could do a standing, or I'm going to hold on to the chair. Make sure you do that. Put your arm like this. Again, not at the top of the foot, but above the ankle like so. And just bring it to the buttocks. And if you can't reach your ankle, again, this is kind of a repeat like what we did lying down. Just hook the foot like this over a belt. And like so. And bring it right up to the buttocks. And again, I'm going to be doing that stretching against resistance. So we're going to be coming down in this direction, but without changing the range of motion. So I'm going to be pushing like I'm kicking a soccer ball, and relax. And also make sure you're not doing it like this because you're going to lose the stretch. You really want the thigh parallel with the other thigh as if you're just standing with both feet on the ground. And then let's do that again. You can bring the heel closer up to the buttocks and then push against the belt for 10 seconds with 10% of your strength. The next one is on your knees, and you'll want to put your knees on a pillow. And then you're just going to put the back of your foot on a couch or a chair. And I can just rest like this and just even kind of sit and lean into that stretch. Or if you find you're on your knees again in the office, maybe standing is a little too difficult for you. So you can grab onto a chair like so, bring the leg back, and then grab it with your hand like this. And again, if you can't reach that ankle, go ahead and use a belt strap, like so, and then bring the foot right up to the buttocks. And again, we're going to repeat that, stretching against resistance. So go ahead and push down in this direction for 10 seconds with 10% of your strength. Relax, bring it up further, and then push down for 10 seconds with 10% of your strength. So those are your 9 different stretches. And obviously, depending on where you are, if you're at your house, at the office, standing, lying down, you can pick 1 or 2 and do them for 30 seconds to a minute. There's one excellent exercise for the knees. So the quadriceps is 4 muscles. There's one little muscle in here called the vastus intermedius that tends to be a little bit weak. So to strengthen that, I'm going to bend this leg just to protect my low back. You're just going to bring your toe out 15 degrees. So this is 45 degrees. You're only going to go this much. And then with 1 inch, just lift your leg up like so. And then hold it for about 40 seconds. So if this is the knee that's bothering you, you can isolate to see if this muscle is the culprit by doing the same thing, but on the other side and lifting it up like so, 15 degrees out. And if you find that one is more difficult than the other, and the one that is more difficult is the one that you're having problems with, then you might deduce that this is the culprit. So let's try this again. I'm going to bend this leg, bring this out 15 degrees, no more than that, and lift up. And if you find yourself shaking on this leg and not with the other leg, then you probably need to keep doing this 3 to 5 times a day for about 40 seconds to a minute. We will be launching a new YouTube video every Wednesday and Friday at 3 p.m. And I'll be available for any questions you have or suggestions for future videos.